This is the HeadRush Podcast with Paul Fraze and Corey Berry.
Welcome to the HeadRush Podcast. I'm Paul Fraze, and I played 11 years in the NFL. And our co-host, Corey Berry, he actually rode rodeo.
I didn't play rodeo.
He rode professional rodeo for 9 years. That's a lot of years. What is that? Is that an average span?
Some people have less, some people have more. Right. I mean, you look at Clint Corey, he 18-time NFR qualifier. Bruce Ford, 19-time NFR qualifier. To Casey Fields, 6-time NFL or NFR.
Well, okay, so nine is a pretty sweet spot. That's impressive.
Right.
Period.
I didn't make enough to get my gold card.
Okay. All right. Well, he's ridden. He was a bareback bronc rider, and let's talk about what we do at the HeadRush Podcast.
I'd like that.
All right. At the HeadRush Podcast, we talk about everything related to brain trauma and brain health and wellness. We talk about traumatic brain injury, TBI, chronic traumatic encephalopathy, CTE, traumatic encephalopathy syndrome, TES, which is the closest you can be diagnosed to CTE while still living. And actually, Corey, you are TES probable CTE, correct?
Correct.
We also talk about repeated head impacts, RHI. We cover how traumatic brain injuries can and will cause mental health issues such as depression, addiction, lack of executive function, memory loss, even suicide ideation, as well as degenerative neurological issues. These symptoms can be found on the Mayo Clinic and Boston University websites under symptoms of CTE. Our mantra is how to cope and find hope. We focus our energy on finding therapies and sharing hope through education and by raising awareness. Corey, will you please do us the honor of introducing our esteemed guest and friend and doctor?
I don't think she needs an introduction.
Well, that's true.
She's been on our podcast twice now.
3 times. This is the third time.
This is the third time that she's been on. She's also mine and your doctor.
Yes.
She's a very big part of our lives.
Yes. A very, very good part.
We wouldn't know what to do without having Dr. Damayo.
Exactly.
So our guest is... with us is Dr. Mizyl Damayo, the medical director of Paradise Behavioral Health, located in Punta Gorda, Florida. Did I say that right? Punta Gorda.
Yes.
But it's Florida, not Florida.
However you want to say it.
Dr. Damayo is certified by the American Board of Psychiatry and Neurology, as well as the American Board, and you just corrected us on this. It's no longer of addiction medicine, but it's preventative medicine for addiction.
Yes.
And Dr. Damayo, primary areas of expertise are, this ain't right, addiction medicine, depression, and anxiety? No. That ain't her primary area.
Well, that was an old bio then. Dr. Damayo, would you fill us in?
It's the Brainwell program.
Well, I guess I can talk about I would say my journey to the Brainwell program. It just started with realizing after 10 years of standard traditional psychiatric practice, I really wasn't helping my patients. They've always coming back and saying that didn't work. It quit working. You got something else, doc? So I started looking more integrative, which is, it's kind of a misnomer because like integrative really is a combination of traditional as well as other novel treatments in psychiatry, which is still somewhat new because there's a lot of traditionalists in our field, and that's okay. And, I'm not for the person who just needs their regular prescription of Zoloft. And if they're doing well with it for 10, 20 years, I'm not going to touch that. The only way I'll ever get involved is that if they decide they don't want to do that anymore. So they come to me, or they've been on 20 medicines and they think I can be a miracle worker and find the right medicine for them. When I have to tell them, I'm sorry, that's a myth, because when I do analyze what's going on with a patient, lots of problems, and so it's not just one solution. So yeah, I pull from everything, standard medicines if they need it, the holistic treatment if they need it, but it all starts with trying to figure out what I'm working with.
So that goes into a term that I've heard from you, precision psychiatry, and
Yes.
all of those facets that are involved.
Integrative, holistic psychiatry, lifestyle management, traumatic brain injury, neuroendocrinology, and TMS.
And
Yeah.
she's
She's now doing Sopravito.
opening a new.
You sound like you're saying soprano, but
She's singing with the Sopranos. Doing Sopravito with the Sopranos.
Yeah. That's a new thing that we're doing. But I usually start with TMS because most patients will benefit if they meet the criteria of major depressive disorder. And that's really what a lot of my patients come in to see me for, because they've been on everything else under the sun. And it's, even now patients are like, no one's ever told me anything about genetic testing, which is, which we'll get into. And also, no one's ever considered how hormones affect how they feel, how they think. And then no one's ever even mentioned TMS, even though it's been around for 30 years. And it's a great treatment.
And it's one of those modalities that's covered by insurance in some plans, correct?
I did it.
Yeah. It's with some insurances like Medicare, I mean, we don't even have to get an authorization. We just get it done.
Mm-hmm.
Yeah. They have to fail, and they've made it really easy. Like, you just need to fail one psychiatric medicine.
Right.
Where
Which
other insurances, not so much.
that's
You
pretty.
forgot something on her.
Yeah. Well, we're gonna get to the precision psychiatry.
You forgot something.
I know. I'm gonna ask you. We're gonna back up, and we're gonna get a little juvenile, I guess.
That's all right.
When was your last trip to Disney World or Disneyland? And did you run a marathon or a half marathon or no? Or
I don't do that. Well, I do their 5 and 10K. That's it.
that's enough.
Yeah.
Was it a Disney? Was it a Disney event or no?
Yes, it was a Disney event.
Tell us about your addiction with Disney.
I don't know. I guess it just happened.
What's that?
Since I live in Florida,
Right.
Since I moved to Florida, it's been that way. Yeah, they're always fun. There was always things to do there.
Well, hold on a second. I'm from California, where Disneyland was started, and I wasn't addicted to it.
Well,
like
you're
you
7
are.
hours away from it. You were on the wrong end of California for Disney.
That's true.
Disneyland. So
Yeah, you were on a north part. Yeah, I was in the south, but it didn't really become a thing because people always ask me what's the difference? I'm like, there's really no difference between the coast. It's like you're comparing different worlds. So, anyways, they have a lot more things to do here, especially the gear towards the adults, and especially like the running a marathon. And my fiance has did that 3 years in a row, and then he decided to do something crazy, which is the Dopey challenge, which you're doing 5K, 10K, half, full.
oh gosh,
For,
over a same week. Oh, 3 days. No.
yeah, 4 days. Yeah, I know. He's crazy.
No,
so
thank
I
you.
told him,
You're marrying him, not me.
Well, there's a lot to that word precision psychiatry. I know you
Will forgot something in her bio.
Oh, let's see.
She's on the board of directors of the HeadRush Foundation.
I did not write that in. I'm sorry. Doctor, we, as everybody found out that, we already announced it last Monday. Okay. Yes, Dr. Damayo is a special part of our foundation for the HeadRush Foundation. And we are very, very fortunate to have Dr. Damayo be a part of our medical staff. So thank you. That's what I forgot.
That's what you forgot. Is you got to thank the lady that shows up to vote for what she thinks is right.
I may someday I may have to have her vote against you. So
she very well could. I mean, welcome to my world.
All right.
So, Dr. Damayo, you talk about precision psychiatry. In your terms, in your profession, what does that mean?
It's a step ahead or beyond just doing integrative, because when I was learning about integrative, I was just throwing out supplements to patients and they weren't happy. They said, I can't take this. So then I started applying precision. So I learned what to give and what not to give based on genetics, based on labs. So I'm not overwhelming them, because psychiatric patients, and they're already challenged and with so many things, even with compliance. So I've kind of pared it down to what they really need. That's based on genetics, that's based on labs, and based on what they're needing, based on cognition, mood, depression, anxiety, and adding all the other modalities at the end of it, in addition to the supplements, what is best for the patient beyond the medications, beyond the supplements. And we figure it out from there. If the patient does look like they're having hormonal imbalances, then we'll address that and move on.
Tell us. So you go over it really quickly. You say genetics and hormones, right? Give us an example of why are you looking at genetics, Doc? What does that mean? What tell us something that you look for and it helps you. There's a reason why a lot of patients don't respond to medications, and it's because we're failing to look at genetics. What is a patient capable of? And I think everyone's heard me talk about MTHFR deficiency. That's your poor ability to not metabolize folate to the activated folate that then becomes all those neurotransmitters, serotonin, dopamine, norepinephrine, as well as bringing down homocysteine, because that is very highly inflammatory to the vasculature of the brain, along with the heart. So we need to know these things. And I just had a patient yesterday. I think he had 10, 12 medications he was on before. And he did bring in his genetic testing. Somebody did that for him. And said nothing worked in this list. And I looked at it and I said, do you understand that you're MTHFR deficient? And like, no, nobody said that to me. I was like, well, maybe this is the missing link. And from there, other complications can happen with people. Like I look at also the brain-derived neurotropic factor. Not a lot of people, but people who struggle with mental health and sometimes have a poor ability to make healthy brain cells. So that's a struggle, especially in somebody with traumatic brain injury. So if that's a problem, then we need to support that. How do we increase patients' brain-derived neurotropic factor? The third one that I look at, and I'm doing a lot more now with genetics, but the third one that I was really looking at before too is the COMT gene. COMT, it's not a matter of like it's abnormal. We have to know, is it high or low? And they're totally, totally different when it comes to the approach. When you have high COMT, you're a rapid dopamine metabolizer.
This is what we call the warrior gene. This is what I call the ADHD gene, because you run low in dopamine, you rapidly metabolize it. And so these are the ones that can't sit still, but they're actually pretty good in terms of working in a high-paced environment. You want that person. And the opposite is the warrior gene, meaning they are low COMT, they are slow metabolizers of dopamine. And good and bad with that patient. I find it a lot with people who have anxiety, obsessive compulsive disorder, even in autism, because these people with autism are just extremely anxious because they don't know how to socialize. So, but the good things about these patients that they are reliable. These are the accountants. These are the people that really make sure everything is where it needs to be. But I also have to tell these patients that they have to not put too much on themselves, even though they always say no good deed goes unpunished, because they're great workers. But I have to tell them stop, because you are gonna have a meltdown if you do too much, because they like regimen. So those are the things. And then when you have somebody with MTHFR deficiency and a low COMT or a high COMT, then the problem also becomes worrisome, because you're trying to treat one and going to make the condition worse. So at that point, that's why I really need to know what the correlation is between those two genes. And there's other genes going on too, like the MTR and MTRR. And those are people who are poor methylators of B12. And it's not only that too. Some people are poor absorbers of B12. They just can't absorb into the gut, just like somebody who has a problem with, who's had a gastric bypass. So I think I just had a patient the other day say, once I found out all that, they couldn't absorb B12, they couldn't methylate folate, they couldn't methylate B12. Once I told them to take a sublingual, they're like, yeah, I think my mood is better, because I was telling her to take a B12 the whole time. And I ran some other tests, and they're like, you can't absorb it, you can't methylate it. I would say 50-50. The time a patient who is MTHFR deficient, they can't methylate folate, they cannot methylate B12. So this is why a lot of other integrative docs will just automatically tell them to take a methylated B12. But when it comes to precision, I need to know that, because I don't want to tell them to take unnecessary things. So that, I guess, in a nutshell, is how precision psychiatry happens from a genetic perspective.
If you've been told it's all in your head, but deep down you know something is wrong, listen closely. Brain fog, depression, anxiety, irritability, even PTSD, these are not just mental issues. They may be signals of neuroinflammation and hormonal disruption, root causes that traditional medicine often ignores. At the Millennium Health Centers, founded by Dr. Mark Gordon, they have helped veterans, athletes, and everyday people restore brain function using a medical process called the Millennium Protocol. Take their free brain health assessment at tbihelpnow.org and discover if inflammation, not weakness, is holding you back. You're not broken, you're unbalanced, and balance can be restored.
Me and Paul both are MTHFR low COMT.
And I don't know why you guys don't kill each other.
Oh, we've been reserved.
We got good.
We have a good moral compass, because where would you hide the bodies? So
I'm in Texas. I can hide them anywhere.
Yeah. Well, there's lots of places in Florida too,
Well. So let's get back to the.
That's why I don't go to Florida.
So when you talk about MTHFR, you're talking about folic acid converting to methylfolate, right?
Yes.
Is methylfolate a B12 derivative or what?
Yes. Yeah. Only body is able to activate it, or you have to take the activated form.
Only the body is able to activate it. And if you have that, you don't, or say, I don't activate it too well. And then when I was low COMT, and then we started taking methylfolate,
Yes.
And
What did I tell you?
Within 2 weeks, well, you said, Paul, you might be a little anxious on this. Let's talk in 2 weeks. And 2 weeks later, we talked, and I said, Doc, I'm kind of anxious. What's going on? And you said, cut it in half or lower the dose. And for those kinds of patients, I think I have you also just taking a super low, right,
methylated folate, because patients like you, they need some,
right,
but not too much.
Right. So
she doesn't have me on any.
Right.
Yeah, because I don't want you to get too
wound up.
You're already wound up.
He gets fired up. He's
I was fired up yesterday. Holy cow!
All right, give us an example about hormones. What do you do with hormones? What do you mean hormones?
Yeah, this is the interesting thing, that you still have to apply precision to it, meaning you have to look at the genetics. COMT is an interesting gene because it also metabolizes estrogen, so it breaks that down. So if you don't know that and you're throwing a bunch of hormones, especially testosterone, that converts to estrogen, or
I like the pellets. I like the pellets or big shots of testosterone. Is that what I should take, or?
I don't know about that.
I'm just totally kidding. Go.
Yeah, you don't even want to know how many women I've had to back off they were on pellets, and they come in with anxiety and their testosterone is higher than the men, and I was like, okay, I think we need to tone this down.
How many of those felt better after you kind of toned things down?
Oh, yeah, I have one I was working on for about a year and a half, just trying to get her off the pellets so the anxiety goes down. And then I had to rebuild her back up with the hormones that I gave her, natural supplements, as in addition to maybe do I need to give her like some appropriate estradiol, appropriate progesterone, and even testosterone. Once we finally got that right, she's like, I feel perfect. I'm not anxious anymore. I feel calm, and her husband's happy. So,
right.
So I always say, sometimes this program, which we'll talk about, which I created, that's how I met you guys, the Brainwell program, can save, relationships. So we can get onto that. So the hormone piece is, you have to know what your genetics is, or else, because I had this happen and I didn't know that the patient was low COMT because that wasn't in his genetic test. And so I was giving him testosterone, and then I reordered the test. And then, of course, he called me a week before I got the test results. I said, Doc, I'm getting anxious right now with this testosterone. And I said, oh, okay, let me look at your, repeat genetic test. And he was low COMT. And so I said, okay, stop that testosterone, and we need to back it up and just do a little bit more natural, which is what as Mark Gordon taught me how to do, which is always the better way to go, because you're not dependent on those chemicals unless you really have to. So, it was much better after I stopped the testosterone and worked on the back end, increasing the pregnenolone only. And because of the fact that he was a poor metabolizer of the estradiol, which increased his anxiety. So, so we have to know those things. And from there, I look at the hormones too. I want to know, it's not because you're low T, low estrogen. Is there a connection between that and brain dysfunction? Because a lot of times people don't even know they've had a brain injury, and they don't want to believe me when I tell them your labs are telling me you've had a brain injury, and that's why you're low T, that's why you're low estrogen, or that's why you're low cortisol. And it's kind of hard for them. And then they start walking back and say, yeah, you know what? Yeah, I think I remember I got up real quick and I banged my head into something, because people mostly think traumatic brain injury is just like a huge one where you wind up in the hospital, but if you, as Paul, all those multiple hits in playing NFL, riding Bronco, or even in the military, prone to blast injuries. It causes a knock in the head multiple times. And then some, in those situations, you don't see those results. And we talked about this, Corey, like most people don't go see a neurologist when they're having mental health issues from a brain injury. They come to the psychiatrist, and unfortunately, most of the time they just put them on whatever, benzos or SSRIs or something that's really not treating the root cause. And then, they come back and say, this isn't working. And then Mark always said, it's not treatment-resistant depression unless you look at the hormones. And he was right. And I knew that was the answer. I just didn't know how to make that happen for my patients until I got with the Millennium Protocol. So that was eye-opening for me. So, yeah, precision, yeah.
Really quick, is there a correlation with, are there some drugs or SSRI drugs, just to give an example, do they work on every patient? Are there some patients that don't respond to SSRI drugs? And is that a genetic component, or is that
75% failure rate?
Yeah.
Mm-hmm. Yeah. It's a combination of both. That's why you really have to know what you're looking at when you're genetic tests. Some patients just have, SSRIs are, I would say, they depend on the receptor to pick up the serotonin back into the brain. Okay, so that's why they call it SSRIs.
Serotonin reuptake, something.
Yeah, I don't know what's going on. I'm still sick, so so now you're seeing it, Paul. Anyways, yeah, reuptake inhibitor, and there's people that are born with a genetic predisposition to not have those things functioning. So in those cases, then you have to go with a non-SSRI. There's also people that don't have good serotonin receptors. So those things are not good. SSRIs are not good for them either. Yeah, but then you come across a patient who's also like, the low COMT where they can't, and they can't take SSRIs, and you're like, okay, this is going to be a real challenge. And then that's when I put on my integrative hat and go more holistic. It's like, you're going to have to do this in order to not make the treatment cause harm. So that plays into a factor too. And there's another thing I've noticed too. Yeah. As somebody who is low T, and maybe you even know that they've had a head injury and they're not responding to psychiatric meds, then you better be checking that testosterone because it could probably be low. And this is what I noticed too, even with standard psychiatric treatment, even with TMS, which we will get into later, if you have a lot of inflammation, toxins, that really interferes. Even with standard treatment with people that I know that are not low dopamine metabolizers, and I give them L-methylfolate because they're full of inflammation, they can't tolerate the L-methylfolate, not even at the lowest dose. So each patient is unique. So I guess that comes with also the precision with it, like no two person is alike. And that's kind of fun for me. I like the challenge.
This episode of the HeadRush Podcast is brought to you by our personal doctor and team of doctors, Dr. Mizyl Damayo, and she's with the Paradise Behavioral Health, and we are in the
Brainwell program, which is also part of the Millennium Health Center. Dr. Mark Gordon, you've seen him on Joe Rogan and even on our show, the HeadRush Podcast. And hormones. And Mizyl is awesome. We love her.
She's our doctor of psychiatry. She works the Mark Gordon program with the hormones, and she adds her twist of genetics, and it basically is melding two wonderful mediums together, and we're getting great help from Dr. Mizyl Damayo.
So please check out her website at paradisebehavioral.com. Look up the Brainwell program. Get involved.
She's sponsoring us. They're sponsoring us for the next year, so we are excited to have them on board and shout the good news to everybody that is watching these broadcasts. So,
is she helping you, Paul?
Absolutely,
she's helping me. So go check her out. ParadiseBehavioralHealth.com.
So we've talked about different components. We've talked about genetics. We've talked about hormones. We've talked about inflammation. We've talked how did that all come together for your program that you have, the Brainwell program?
Yeah. We have to get away from that notion that there is one treatment for all. So that's where the precision comes in. Run the labs, look at inflammatory markers, look at methylation in your genetics, look at vitamin deficiencies, look at hormones, look at the brain hormones. And sometimes I have to have patients do a tox panel, and in order to figure out where the inflammation is coming from. And this is where also I've started getting into looking at the omega 6-3 ratio. Sometimes that's a problem, no matter what I do to the patient, even if it's like something that I think will be good for them. If we do not get the brain healthy and it's too much omega-6, not enough omega-3, then we're in trouble with neuroinflammation. So no matter what I do, they're not going to get the best benefit, whatever it is I offer them, including even hormones. When you talk about hormones, and if you know that they're full of inflammation, we need to make sure that they don't have toxins like BPA, which is found in plastics because it causes endocrine disruption. You may see a woman that is, I would say, low estrogen, and you give that, estrogen to her, and she starts having lots of side effects. Maybe it was the inflammation full of BPA. They're already sitting on those estrogen receptors and you weren't even aware of it. And you're like, well, that should have helped you because you're low estrogen. But, it's a challenge to try to figure out what is happening with a patient. But if you understand, you have to look at the patient holistically and all these things happening. Toxins, inflammation, brain injury, hormonal imbalance, genetic issues. I think it's important. We have to think about that before we make the next move on a patient.
And so you decided to change the way it works.
Yeah. And so that came to where I wound up creating the Brainwell program, because I thought, like, once I learned about Millennium Protocol, that was the end all. But then, Mark was really stressing a lot more about inflammation and even gut health at the end. So there are genetic markers for people who are prone to poor gut health. And we need to address that. And we got to make sure they're taking a good probiotic. And sometimes, even if I'm struggling with a patient and I've done everything right, and nothing is working, then I do refer them on for GI mapping. And I'd be surprised at the things I do find there. That's just, we can talk a little bit more about that, but it talks about what's going on with your gut. How is your gut health? What is in there that's preventing you? Because the gut is like one of it's sometimes considered a bigger brain than our brain because it is also making serotonin. And so if that's not healthy, then what feeds the gut feeds the brain. So the brain is also going to be full of inflammation. So
that's one thing. What you're talking about, neurosteroids and neuroactive steroids, and dumb it down, doc, please. So neurosteroids are made in the brain, and the neuroactive are made in the gut, but they go to the brain eventually, or
yes, they do.
The gut. There's all this talk about the gut and the brain being one.
Yeah, they call it the gut-brain axis. Because at first I didn't really quite understand, like, what's the gut have to do with the brain, until like I went to a lecture and they really explained it. And I'm like, yeah, what you feed your brain comes from your gut. So you gotta eat healthy. You gotta avoid inflammatory foods, avoid toxins, and then maybe you'll have a healthy brain. Maybe we don't need to give you any psychiatric medications. And that's happened for some of my patients, that I just tell them, you need to avoid certain foods. You need to work on getting your brain healthy. And I even had somebody just 2 weeks into the protocol of getting their brain healthy, removing omega-6 and increasing omega-3. The anxiety has gone down. The neurologic nervous system has improved. So it's amazing what you can do for patients outside of standard treatment, because Corey brought it up, like I think really, 75, maybe 85% of patients after the fourth medicine, they don't respond to medications anymore. So we got to look at things from a holistic, comprehensive perspective to figure out what's interfering with the treatment. Maybe the treatment is really not what it is. Maybe we need to work on balancing the hormones. Maybe we work on removing inflammation, because what I do with patients, if I do find a lot of inflammation, I don't even go with hormones yet. I say we need to bring down that inflammation. And sometimes 50-50 is they get better, but the other, times it's like, well, okay, doc, let's work on my hormones now. It's like, you're ready. And I don't have those abnormal anxiety reactions that happens when I work on bringing down the inflammation first.
Millions live with depression, anxiety, fatigue, or emotional chaos, believing it's permanent. It's not. The Millennium Protocol targets hidden inflammation and hormone disruption caused by trauma, stress, and time. Created by Dr. Mark Gordon, featured multiple times on Joe Rogan and the HeadRush Podcast, plus the documentary movie Quiet Explosions, this approach has transformed lives once written off as hopeless. Visit tbihelpnow.org and take the 10-question brain health assessment. Healing is possible. Your story isn't over. Let's begin again with your brain. I got a lot of inflammation.
Yes, you do.
Not to mention, I gave myself 2 concussions in the last month.
What are you doing? You're like putting insult to injury here.
Yep, I went to step off a step and my knee gave out and I went down. We went to Sam that Wednesday and she goes, you gave yourself a concussion. And then during the ice storm here, a week ago?
You tried to go ice skating?
Yeah, I tried to go ice skating and
Dallas
fell
Stars
right on my head.
Oh my goodness.
So, yeah, my gut and my brain are all messed up still, and it's not your fault. It's not no one's fault. It's just how I am, and I don't know how to get the inflammation off. I'm going to try that Violite. The red light therapy.
Photobiomodulation.
Biomodulation.
Yes.
And but I mean,
you've been.
But I gotta say, you go back. We've been together a year now. Nice cup, a Mac Parkman cup. Keep it green.
I think it's been a year. Yeah.
Yeah, it's been.
So if you go back and look, when I first started, my testosterone was at 3 when I went to the urologist.
Okay.
They put me on 200 cc's a week of testosterone, TRT therapy.
Cypionate.
And then I met with Mizyl, and she's like, you're outrageous. And she goes, let's start doing this and pregnenolone. And all these other supplements, which I'm still doing today, folks. But it got me down to where I only used 3/4 of that 200 cc. Then I went down to using half of that 200 cc. Then I went down to using 1/4 of that 200 cc. You know how much testosterone therapy I do now?
No. What? How much?
None.
Really?
None.
What were your last blood?
What was my last blood?
I'm going to look at it right now. Yeah. You know what? This is funny because this is, I think you were off testosterone. Your total was 800.
Still 800? That's pretty darn good for...
That's without the shots.
Good.
Yeah. So this is the last one. Yeah. That I did for you.
How much you were crazy up there when they had you in the
1800s, 1300s.
Yeah.
Oh gosh.
Yeah. So so that speaks volumes to the program that there is a way to treat low T without having to always go towards testosterone replacement. So
I know Dr. Gordon, he told us a lot about when we were at the Mac Parkman Foundation event, the Global Summit, I don't know, in May?
International Summit.
March, April, May, whatever it was. We saw you there, obviously.
Yeah, that was fun.
Yeah, that was fun. But he was talking about the Motrin or the ibuprofen, high doses of that actually drive T down.
I quit taking it all together.
I mean, he was saying the veterans were coming back after taking 800 milligrams twice a day type of thing. That what do they used to call? Or I heard a veteran say that they used to call it vitamin something. I mean, obviously
vitamin M.
Maybe that.
Yeah.
That would be the obvious choice.
Yeah, I used to take Aleve and ibuprofen, Tylenol together because it makes it more chemical, like
are they like protagonist, or I mean they're
more like a pain reliever, big
synergistic
right. And I haven't touched an Aleve or an ibuprofen in months. And I'm hurting. And I mean, when I get hurting real bad, I got a pain pill. I reach down in the bottom cupboard and go, you know, it's been about 4 months. Let's go ahead and relieve a little bit of pain for today. But again, you know, people like me and you and competitors and athletes that beat up our bodies, if I don't wake up in pain, I'm dead. There's no such thing as me ever being out of pain. Is there for you?
Right. No, there's always something. There's always something I could complain about. So
you know, so I mean, it's just the way of life. So if I can deal with a little bit of pain and keep me away from that ibuprofen and all of that stuff, I'm miles ahead after talking to Mark Gordon. I don't want to destroy my testosterone. I've already done that. Now I got to rebuild back up. Why would I want to destroy it again?
Did you just said something about 10 minutes ago that your gut and your brain is totally messed up. You are taking strides to clean up your diet. You've been doing really good. You lowered your sugar intake.
Oh yeah, I mean, my diet, but my gut and my brain are still messed up. You know, with the diet I'm on, I should be able to wipe my butt with a bamboo stick.
Oh my Lord!
But I so
go on the keto diet, and then you can't even go to the restroom.
Right, and so I mean but I still got a lot of inflammation, and I'm sure these last 2 concussions didn't help any.
Right.
If not made everything worse.
Well,
it started me back at ground zero.
No, I don't think ground zero, because you've admitted that you are feeling better and doing more. Would you have gone to work out at the gym 2 years ago?
Not a chance. And
you actually, I hear you probably sometimes 3 times a week. You're saying you're going to the gym.
Right.
Oh, that's
Well, Corey, remember what was your one goal when you came in to see me? Do you remember what that was?
No.
It was, you said you wanted to walk your daughter down the aisle.
Oh, yeah. And I did.
And you did. You even danced. You even like took the first dance.
Well, I have to as a proud papa.
Well,
But I know with the way your brain was prior to me working with you,
Oh,
you saw
never.
there's absolutely no way. So this is what I have to tell my patients,
Baby steps.
yeah, well, not only that, I mean, like, it's all about how much damage is in your brain, but
how long
you're
did it take you?
yeah, if you're seeing progress, then, we just keep going forward with it and give it time, because it's all about the plasticity of the brain too, that it does heal. We are designed to heal. So, yeah, try not to knock your head too many times after.
I don't think there's a healing process in me. I think it's just kind of maintained now. I think I've gone from the Paul phrase, we can cure this, it's all inflammation in the brain, I can be 100% to, I think if I can just maintain the level I'm at now, where, yes, yesterday was a real bad day, and I've had a couple of them, and my short-term memory is, what did I just say?
Yeah, right.
It's,
I saw Susan pointed to your calendar, and I saw like 3 or 4 in a row, happy green, happy smiley faces. You had 4 days in a row that were pretty darn good, and then yesterday went to heck in a handbasket.
It went a lot further than heck. It was destroyed yesterday. Yesterday I did a bunch of memory loss problems. I put the milk in the cabinet.
But it was almond milk, so you could have gotten away with having it in the cabinet for a day or so.
I took out the P-trap in the kitchen
to clean it out.
To clean out the P-trap. I grabbed it, put it under the sink, turned on the water, cleaned it out on the sink, set it on the counter, washed my hands, dried it, turned off the water, and I sat there and went,
why is there water draining out of the cabinet?
And on the floor and on my feet. And it's like, oh my God, I forgot to put the P-trap back in.
Well, that started your cascading event. Yeah.
That tells me you need to keep going. And I think you're on that one product Dr. Gordon has, NeuroShield. I think it's great.
I don't go anywhere with I was actually on the NeuroShield, and what was the spray?
Dinotrophin?
Right.
And the
Dinotrophin.
Okay.
And then Mizyl said, no, don't do both. Do one or the other. So I went back to the NeuroShield.
Right.
Yeah. So,
and why did you say that to him? Because of his genetics and, right.
Yeah, it's a lot of those like growth hormone stimulators are full of proteins. So I'm trying to remove anything with you, Corey, that could potentially, make things worse for you. So we have to weed out all the triggers so we can start healing.
Will the proteins cause inflammation? I mean, too many proteins?
It's the buildup of dopamine.
Oh,
so
okay.
So we try to remove those things since you tend to keep those higher anyways. So that's why, we try with a lot of the patients who are, low dopamine metabolizers, we have to be careful. Even telling them keto diet is great for the brain. But I had one patient who was low COMT, and her nutritionist said, do your keto diet. And she did, and she got more anxious. So she came back to me and said, Yeah, Doc, you were right. I should have listened to you. But there are cases that people with low dopamine metabolism can do keto. It all depends on whether their hormones are where they need to be, especially pregnenolone, because that counteracts anything that dopamine does, because pregnenolone increases GABA in the brain. So I see this in people who naturally run high in progesterone, pregnenolone, even in men, and they have that genetic issue, and they're like, I don't have no anxiety, So like, it's all about balancing everything, how one plays against the other.
So let's go. You got my file pulled up right now, right?
Yes.
Let's go back and look at my first and my last and explain the differences in my hormones and everything.
Yeah. So let's see. That was the last. No, I'm sorry. I look up. It was May. Man. Oh, sorry, Paul. I was looking at yours, Paul.
Yeah.
Okay, let's do
So I
Paul.
gave you the wrong ones, Corey. Sorry.
Oh, you're at 800 testosterone.
Yeah. And you're not reading anything.
I want to hear where you are now.
23.
Okay. The last one that I did, that I ran the labs for you, let's see.
2-3 months ago.
Yeah, no, this was September of last year. So let me take a look at, what did I do? Okay, I'm looking at, it's easier for me to look at the Millennium Report, which I did in October. Okay.
Because I know I got to do labs probably
Soon.
next
Okay,
month.
yeah.
I do too.
So yours, without any testosterone placement, your testosterone was 500.
500,
So
which is not, it's not bad.
I need a little higher.
He wants it a little higher.
he wants it like Paul.
I would love to have an 800
No,
testosterone.
my buddy who I played ball with years and years ago, he was
My
telling me,
wife wouldn't, but
my buddy was saying, "Oh, I've got the pellets and I'm up to 1400," and I'm like, I don't want muscles on top of muscles. I just want to be, normal. Anyway,
Yeah.
it was
Yeah, so
But let's go back now, since you got my file pulled up. Go back from a year ago when we started to now.
Yeah.
And how much of a balancing act I did and what's improved.
yeah, so I don't know why no, this is not right. Okay. I don't know why your first Millennium Protocol is not here. I gotta look at it. It's just, there's a lot to go through. Okay. Yeah, so I think you did your labs in, I think it was May, but I don't think we got down to working with it. So at that time, this is February 2025. Your testosterone was high because you were like on those replacements. And let's see what else is going on. I don't know why I'm not finding your original. This is so weird. Okay. Actually, it was 2024 that I did your first set of labs. So let's take a look at this. Yeah.
So over a year.
I'm looking at your chart, Corey. I'm not looking at Paul's.
Paul's was 2023, right? When you started with?
probably, or
Yeah, this is 2024. Okay. Your testosterone, when I first checked in 24, this is when you were on TRT, was like 1400. And of course, you killed everything else prior to it. You had no pregnenolone, nothing prior to it. And this is why you were struggling with anxiety and some memory issues. And it was like doing more harm than good. Of course, you still have quite a bit of inflammation at that point. So let's look at, I think we checked it in February 2025. So let's see.
We checked it just a few months ago.
Yeah, I'm just looking at the next one.
Oh, okay.
Yeah, I'm looking at the next one. Your progesterone went up, and I like to keep it there, even for a male, because of you and your rages. I like to call the progesterone the peace hormone. Okay.
Oh, that's the
No
peace hormone.
for that.
She wants to give me the female.
Well, cashews are nature's natural Prozac, aren't they? Something like that.
I don't know.
Yeah.
I don't know about that, but because there are some good things in there. Okay, and then so the last one that I did for you was that, and this was like September of last year. So let's take a look at that, and that was the one where you were not on the testosterone, and then you're
Clomid.
were you on Clomid?
Yeah, I still am. I'm 3 days a week.
Yeah. Okay. Yeah. So we worked on supporting the luteinizing hormone with the clomipene. That helped, in addition to you taking pregnenolone, which is the mother of all hormones. So like it created all those things. And so this is a testimony that we don't have to use shots because that kind of disrupts everything else.
Mm-hmm.
So now your pregnenolone is good, your progesterone is good, and your testosterone is
Stop. CTE.org proudly sponsors the HeadRush Podcast.
Karen and Doug Ziegel, they are founders. Karen founded the Patrick Grisha CTE Awareness Foundation, and they are one of the most comprehensive websites regarding repeated head impacts and chronic traumatic encephalopathy. They work with legislature. They've been doing this for about 10 years.
They're the grandparents of CTE in my book. So don't knock it. StopCTE.org.
I'm gonna ask you one more medical question. We're coming down to the end. There's a term that Dr. Lewis uses in his book and Dr. Gordon uses. And it's neuropermissive.
Mm-hmm.
And I think all of this wraps into helping to create a neuropermissive environment. And can there actually be healing in the brain with a neuropermissive environment? Neuropermissive environment? Just a question.
Yeah. Well, yeah. But we need to know what's causing, all those problems in the brain.
Mm.
Is it toxic? Is it continued head injury? Even bad relationships and toxic relationship, toxic workplace all causes inflammation in the brain.
Mm-hmm.
So we got to remove all those factors if we can help it. But then even therapy can help. Trying to learn relaxation skills and doing exercise, relaxation exercises. All those things will also bring down inflammation, along with removing anything in the diet that could be causing it. You mentioned Michael Lewis. He really turned me on to the omegas because I was like, what is this?
Mm-hmm. All right.
But then I finally started reading more into it. I'm like, yeah, because if your omega-3s are low and you have too much omega-6, that causes neuroinflammation. And it's using omega-6 to build the brain cell instead of the omega-3 because you don't have enough of it.
Mm.
And so, we have to give the brain that neuropermissive environment, antioxidants, and in addition to a good diet, the kind of exercise that you need based on your genetics. All those things.
In layman's terms, can I be healed, Doc?
Demons out!
Well, you're on your way. You're on your way. But I find that with mental health, even with patients that are not on psychiatric meds, I still see them. And it's because, they have some genetic issues that maybe they haven't really attended to, even though I told them you shouldn't stop that supplement, But
I stop everything you tell me to.
Mm-hmm.
If you told me to quit walking on my left shoe, I'd quit walking on it to maybe feel better.
Well, you didn't.
Wow. That power.
He stopped using the Copenhagen. right?
Yeah. I don't do no more nicotine or tobacco.
Wow. Do you miss it?
No, I got fake chew I put in my lip now.
He can swallow it.
Oh, it's better than nicotine.
It's all
Natural, right? It's
natural.
like organic and straw. You put in straw. They're not paying us for advertising. So
I know, that's what I'm-
By the way,
Made in Capel.
oh, is it really? No. Dr. Mizyl Damayo, thank you. You've been a game changer in both of our worlds.
100%.
Yeah.
She's been a game changer on the HeadRush podcast.
Yes. Yep. She's
And we'd love to have her come on and talk. We'd love to have her on our board of directors. We see a lot of good things come from Dr. Damayo, and I am pleased every day to know that I'm a tech. You know, I'm going to say something right now. I have reached to a point, and it's taken a lifetime. If you want to get better and feel better, you get with the right doctors, you get with the right people around you, you circle yourself around people, and you eliminate the evil people. I can get on my phone, I can text Mizyl Damayo 24/7. I can text Jeremy Tanner. I can text Dr. Katzer. I can text Crystal. I can text Mark Gordon. And this is because I am circling myself around people that care about my health and my well-being. I could even text Chris Nowinski.
yes, you can.
You know, so I mean, you look, and I've called Mike Alasko. You know, I got direct numbers to a lot of people. And if you want to feel better, if you want to get better, you hook around doctors that are there for you and not just because they went to school for 12 years to get a degree.
Not including, I guess, elementary and high school.
No, I'm college is what I'm talking about.
Yeah. Yeah, 12 years.
19 years altogether, but 12 years of after high school.
So
yeah.
you're-
It was a long time.
Yeah.
Tell us about everything has culminated into what you have developed called the Brainwell program.
Yeah, the Brainwell program is just a compilation of using principles of precision psychiatry, but we got to do the work with genetics. We got to do the work with labs, hormones, even a tox panel. And then from there, we correlate what's best for the patient. And because sometimes one thing may be they need it, but then they have conflicting genetics, and we don't do that. So, this way I'm giving patients the proper kind of supplements. Yeah, I have patients who come all the time and asking me, what about this, doc? What about that, doc? And I'm like, if you don't hear it coming out of my mouth, don't bother. But of course, you can ask, okay? But because you would just be wasting your money. I don't want my patients to be doing that because they're already challenged and frustrated with what the whole world and social media tells them. So it's very important that you work with a doctor that understands these things. And, did I come to this all on my own? Yes and no. I've been very
You've
blessed.
had a lot of help.
Well, you've cherry picked some really wonderful brains and people that you knew could bring wholeness and completeness to your program, your brain wellness program, and you've initiated a lot of that content as well. I mean, I've never heard of a doctor of psychiatry and taking genetic testing. Really? Why are you doing that, Dr. Damayo? Really? And now we know.
Yeah.
I mean,
Well, it's all about how you use the test. So, but at the end of the day, we are adding I do have the TMS, but then I also added vagal nerve stimulation. It was treatment back then. It kind of fell out of favor, but they redid the study and actually did show that it does have an ability to treat treatment depression disorder and treatment resistant, as well as bipolar. So I have one patient on it. I struggle. I gave him 2 TMS. He was on HRT, nothing. And he was really good at following things until, because he was desperate as well. So I was like, well, do you want an implant on your vagus nerve? And, he's not 100%, but he's like, I feel better.
wow.
At least he has hope, because he always come in and be just glum. So, and then we're adding another layer with Spravato, and this is the only FDA approved form of ketamine. It's S-ketamine, which is the stronger portion of the ketamine between the two. But I like it because I know I'm going to get a consistent level, because it comes from the manufacturer. It's always going to be the same. And the company is actually really good at supporting us. So I'm excited. I think my first 2 is next week, so that will be good. It is also really good for brain-derived neurotropic factor as well. It's better for people who are really glum depression, because what it does, it actually elevates the glutamate at that time, because that's also a theory why people are depressed. And because they don't have enough glutamate, they have too much GABA in them. So this medicine, kind of balances that.
Well, thank you so much. You've been a wonderful friend. You've been a wonderful sponsor of the HeadRush podcast. You've been answering our calls and saying, Paul, what do you have this time? What's going on? Thank you very much.
Hey, hold it. Before you get there, you called me up a couple weeks ago and say you got in trouble by Dr. Damayo.
What
was it for?
What did I do wrong, Doc?
I don't remember.
Oh, we're going to let you off the hook?
No, we'll figure it out. Now we'll bring it back up. We'll start the next episode with what I got in trouble for. What did we miss, Dr. Damayo? Is there anything you want to cover, please?
If anybody's interested, they can just go to the website paradisebehavioral.com/brainwell. And even if you're not in the state, we can still maybe help at least create a treatment plan for you based on the data that you send us. But I can really, really do a lot of good work for people in the state of Florida, because I can do a little bit more intensive if the patient desires that.
Amen. Well,
for me in Texas, she's limited on what she can do for me, and she's probably happy about that. Could you imagine if I was in the Florida Metroplex or something?
You'd be like, Dr. Damayo, knock, 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 knock.
She'd have me fired and gone.
Oh, you don't even bother me. So yeah, you'd say that, but you have my number, but I rarely hear from you unless you really need me. So, I appreciate that.
Yeah.
She'd be feeding me to the gators.
Well, thank you for everything.
You forgot Word of Hope.
Yes. Well, we always end the podcast with a word of hope. Can you share a word of hope with our listeners?
I think I said it before about not giving up, but then surround yourself with people that will bring you more hope and get rid of the negativity. Because if you do that, then you will progress. You will get better.
Mm-hmm.
Hang out with winners, you become a winner. Hang out with losers, you become a loser.
That's why I hang out with you. No, the winner part. The winner part, not the loser part. Oh, thank you. Appreciate it.
All right.
Can we do this again sometime? Possibly down the road?
Sure. Maybe I have something else new. Oh, yeah. Well, there are things still coming forward, I'm working on an AI software that will put a treatment plan together instead of me having to manually do it all the time.
Right.
And that will include explanations from the Millennium Protocol, which is Dr. Gordon's part of the software. I will include that in there.
That's
and
cool.
then once I finish that, I will finish my Brainwell University. So like if anybody else is interested in being able to do what I do, that should be coming hopefully by the end of the year if I don't get too distracted with too much work and travel and going to Disney. So
Going to Disneyland is going to be the biggest distraction.
Disney World.
Yeah.
So-
Disney World.
Hey, if you have the year pass for Disney World, can you go to Disneyland as well? Oh, really?
No, you got to buy separate.
You have
Yeah.
to buy. Okay. All right.
Yeah.
I'm sure she's got that million-mile
Gold pass or
gold pass or whatever at this point.
One more thing though. When talking about Disney, I did do my Asia Disney trip. Like I hit all 3 parks. In
Oh,
Asia.
really?
Yeah, and I think Shanghai was the best.
Really?
But I wouldn't go back there.
No.
But it was the biggest one, and I really enjoyed that.
Have you done Euro Disney yet?
Yes, I did. So that was my goal, to hit all the Disney parks in the world. So
So Japan isn't there one in Japan? Okay, and you want?
yeah, 2
She's
parks.
the ambassador of Disney now.
I know I should, right? But anyways, it's just something fun to do. So yeah.
I know you enjoy it. So, and you've taken your daughter many times,
Yep.
right? Yeah. And you're
So
family.
MIC, see you real soon.
Oh,
KEY. Why? Because we like you. No.
thank you.
All right, guys.
Thank
You have a
you.
good
All right.
weekend. Be well. Love you all.
Love you
Love
too.
you too.
Bye-bye.
Bye.
Bye.
Another great episode
That
with
was fun.
Mizyl Damayo.
Yeah, that was a lot of fun.
Here.
Yeah, we're just wrapping up and we'll be right back with you in 2 minutes and 2 seconds.
Like, yeah, I'm still here, though I can hear anything you talk smack about me. So
We know. We don't. Have you ever talked smack about one of your physicians?
All the time. Before the team I got now?
Oh, before the team you got now?
Yeah. The flipping neurologist I had to deal with before Tanner and Kater.
So there's a difference. Well, obviously, we already talked about it. I've never seen somebody that puts so much into actually a comprehensive. I call it a comprehensive. I don't know. How are you doing?
I'm off right now.
You're off right now. Okay. Thank you for the.
Okay. Hi, guys.
Take care.
Safe.
Love
Okay.
you. Take care.
Bye.
Bye.
All right.
This podcast is for general information only and does not constitute the practice of medicine. The use of this information and the materials linked to this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard and delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.